Hey everyone, CJ here. March is National Athletic Training Month. Athletic trainers are highly trained healthcare professionals dedicated to patient safety through meticulous documentation and evidence based care. From managing acute injuries to navigating complex return to play decisions, your athletic trainer ensures every athlete receives the highest standard of medical attention. Celebrate the experts who have your back.
Did you know that having a full time athletic trainer can save families hundreds of thousands of dollars in medical costs annually? This March, we celebrate National Athletic Training Month. Athletic trainers keep student athletes in the classroom and on the field by providing expert in house care that reduces absenteeism and travel for outside services. Support your local athletic trainers. They are the heartbeat of school safety.
Hey everyone, thanks for tuning in to the CATA Secondary School Podcast. I'm your host, CJ Rosenborough, and in today's episode, we are picking up where we left off on documentation in the secondary school setting. Last episode was a bit of a long one, so we split it into two sections. So we have Ashley and Katie again with us to share their insights and experiences. Before we jump into the conversation, let's kind of recap where we'll be picking up. So last episode, we talked about current documentation standards in athletic training and where we are and why we have some barriers. Today, we're going to talk about what and how do we document, values to documentation and why we should do it. And then we're going to finish it out with navigating those barriers that we discussed in episode 1 or part 1 to improve your documentation in the high school setting, which is really tough. So excited to have the conversation. Ashley, how are you doing this morning?
I'm doing great. How are you, CJ?
I'm fantastic. Katie, we got you nice and awake this morning prior to hitting record. How you doing?
2 cups of coffee in. We're doing great.
Oh, it's going to be that kind of episode. All right. So first starting off with what/how do you document? This is going to be a little bit of a conversation on EMR because I think you have to, the how do you document relies primarily on what kind of EMR that you're using. And Welch, Bacon et al. From 2017 noted that to be effective, you should embrace your EMR and use it to its fullest extent. So even if there are parts that you're not like, I'm not sure I like this that much, to be effective, you have to kind of dive in and try and use it to the fullest extent. And then in 2018, Welch, Bacon et al. Noted that while paper can help with memory, EMRs are often viewed as more efficient to get that documentation done. So, Katie, going into the EMR, we've all used, I think, a lot of different EMRs. Which one do you prefer? All of them kind of have their pros and cons, but which one do you prefer?
The easiest one I've used is Healthy Roster, but I've used ATS, Athletic Trainer Services Systems, something.
Something like
Sorry, ATS. I know what you are. I just don't know what the acronym stands for. I listen. I started with paper and pencil, so here we are, a long ways away from that. I went from Word documents saved on my computer, which was super not protected information, and then lovely, the school district deleted my account one year and that went away. And so then I went to Google Drive, which at least was saved on the school district's server, which was, more secure because the school licensing with like their contracts are more protected. I would not call it HIPAA protected, but it's better than nothing before. And then I went shopping at the NATA annual meeting for which type, and then my company decided on their own outside of what I wanted what to do, and we had a different one. And then now what I know is that after using all the other ones, adjusting my brain to how to use Healthy Roster has been the easiest transition I've had. So but I haven't used all of them, and I know there's other ones that people love and don't love, and so.
Yeah, Ashley, how about you?
Yeah, I'm pretty similar, but I have used sportswear also, and we used that one for a long time, so I got pretty used to that one. I loved the way reports were pooled, and when you were putting in treatments, you could see like the CPT like price for it. I kind of loved that aspect. And on sportswear, you had like on your little kind of dashboard page, you had all of your open injuries just boom right there. And that's what I loved. But right now I'm using Healthy Roster, and I totally agree with Katie. It is pretty user friendly. It's pretty easy to use. So I think I need to dive deeper into it and get better at using it in like all those little aspects of it. But but yeah.
Yeah, I agree. I feel like ATS, sportswear, and healthy roster are kind of the big three, the most commonly used in my experience that I hear people talk about. I've used sportswear similar to Ashley and I liked it. For my brain, it kind of was like all over, so I had trouble. There's a lot of buttons to click and things to see. I think healthy roster is kind of more in tune with how my brain works with like timeline and all that stuff, which I like. But honestly, if you gave me one or the other, you can become efficient in both of them. So it's really just spending the time to learn it and getting used to it. And then I think it really comes down to preference at the end of the day, honestly.
I do think it's taking time to learn it. Like, if you're someone who just wants to automatically be good at it, great, but spend a day, familiarize yourself with it, because I've never thought they were that difficult.
Yeah, no,
True.
they're not. Yeah. It's more of just figure out where to click. And I mean, it's like Epic. So, I mean, Epic, I think, is the top of the line here, Marks. You can just do so much with it and have so much prepped. But it takes you like 2 weeks to even get like somewhat comfortable with it because there's so much. So, yeah, just spend some time, get comfortable with it. Katie, when we're going through our injuries and we might have some kids coming in and you're like, okay, this will be fine in 20 minutes versus, okay, this is an injury versus kind of in between. What do you currently document when you're in the athletic training facility? Obviously, the answer should be everything, but in reality, that doesn't really happen. So, what are your current documentation standards of what gets documented and what doesn't look like?
Are you trying to make everybody mad at me? Like, I feel like you're starting this episode with everybody being mad at me.
No, I want to figure out where we're at.
I make them sign in for everything. If they get an ice bag, if they get a Band-Aid, if they get tape. Here's the thing, the current system I have. So let's start with the old systems I had. Even with Google, all I had was a QR code. It went to a Google Sheets. It said what they wanted. If they said tape, that was the entirety of the documentation. If they said Band-Aid, that was the entirety of the documentation, whatever. Those things are just boom, boom, click, click. It's documented that that's what they got in there. If they come in for an eval, then I write up a full eval. If they come in for treatment, then they're signed in. I just have to write a treatment note, which my treatment notes are not the best. I'll tell you, that's where I lack my documentation the most. But I document every athlete that comes in, assuming they signed in, which I recognize is a problem. You have to start a system with them. You guys, I'll tell you the best thing I ever did sign in wise. You get taped in the order you sign in. If you're not on the list, you go to the back of the line. You know what happens? Everybody signs in. You know what really happens when I had the QR code, which I still like kind of do on game day because it gets chaotic. The kids policed the policy. They would sign in at 6 o'clock in the morning so they could be the first one to get taped at 4 o'clock in game day. But they knew that was the order. So they would come in, I'd pull up the Google sheet on my phone and I'd be like, okay, get in line. And they knew, they could tell you themselves because they'd be like, I have my code. I signed in at 6:32 this morning, and they would get themselves in line. Fantastic, you guys! I cannot recommend more. Even if that's all you do, put your name on the Google sheet for who gets taped first. You're doing a great job.
I love it. So, yeah, I think those treatment notes are the hardest to get done because usually it's in the middle of a really busy ATF. So, I'm kind of similar where I tried to document everything, but it's definitely hard. Ashley, where does that standard fall for you?
I document what I would call encounters, so where I am touching someone. That sounds weird. But like if someone runs into my office and I have like, the drawer of band-aids on the back counter and they just have a tiny little cut on their finger, they ran to get a band-aid and they ran right back out. I did not document that because I didn't touch them. I barely even spoke to them. It's like, hey, you good? Okay, good. like, so that's kind of where I'm at. I'll document ice bags, treatments, and evals.
Do you? I think I already know the answer to this, Ash, but and I'm coming your way, Katie. So prepare yourself. When you have that kid who comes in, and it's like, this isn't much. Is it a sentence
Oh yeah,
eval documentation, or is it like sentence?
pretty much, yeah. And like I do go through like a full eval, right? Especially with something where I'm like, none of this is making sense because all these special tests are normal. But even though, like, because I know those certain kids, right, that they're
Mm-hmm.
coming in every day for something brand new, and all of a sudden, miraculously, the next day, their knee stopped hurting. So,
They've had 5 season-ending injuries in one season.
exactly. So, I do a very quick, all special tests negative, no MOI reported, like, educated on stretching, and pain went away. Like, those are my notes for those ones.
Yeah, mine are very similar. Katie, I'm assuming yours
Yeah,
are similar to that.
I a lot of times just use the word athletic trainer discretion and say, oh, no cause of no known mechanism of injury, reports pain with this, per known history with athlete, suspected this, and you know, will follow up again if they return. And it's not, I don't even mark it as an injury. I mark it as non-injury, and I don't, treatment, change of status, I don't, something like that in our computer, where it's like I don't even, they are still active. There's no, but it's a documented note that because they marked they came in for an eval, it says, what and a lot of times, if I go into, like, I used to just say no manual muscle testing performed, unnecessary at this point, or whatever it is, just to kind of touch all my bases and say this, I didn't need to do all these things based on what they were telling me.
Yeah.
One of my favorite things that I used to do for those kids, because sometimes you don't know who those kids are. But yeah, you document and you have this full injury eval. And then they never come back because, like, they're fine. But so on those notes, I always put spontaneous resolution.
Yep.
I love that wording. I love it. Okay, one thing that I wanted to touch on, this doesn't necessarily have to be like a question, but we talked about it right after our recording of, we were like, how did this introduction get so long? And then Katie brought up, we didn't even touch on a lot of the other stuff that we should be documenting. So I kind of wanted to just throw that out there real quick.
Again, making
There's
everybody hate Katie today.
no, but it's a good point. Like, so do we document infection control, ice machine cleaning, wiping down the tables? I know some of that is like our standard practice, but do we? That's just another interesting thing to document. I think we think about patient care as the only thing we document, but it is important to go through like those EAP trainings and document that, to go through ice machine cleaning and document that, and yada yada. So yeah, Katie, anything else to add on to that?
I was just gonna say, if you're applying for the Safe Schools Sports, what is it? Somebody help
Nailed
me.
it.
The award from the NATA. If you're applying for that, like, it talks about documenting that in there. To a point, here's what I'll tell you, just popped my eyes wide open, and I hadn't thought of it before. The wrestling room walls.
Ooh. Ugh.
Yeah, it made me go, oh, yep, they clean the floor every day, but yeah, sorry, you guys. Didn't mean to. Yep.
Oh,
I
I
hope
feel
the
dirty.
listeners' faces just matched all of your guys's, because we all went through it. I was like, oh no. And then I like went to the athletic director's office, and I was like, can we tell the custodians, like I don't want responsibility here, but like, can we add this to the list?
Did
Oh,
they
that's a really
do
good
it?
point.
I
Because
have no
mine
idea.
wouldn't do it. We're always so short staffed that, like, they
Mm.
wouldn't take that on.
Listen, I had a germaphobe for a wrestling coach. I think my point got taken very seriously
Nice.
with him. But also, I will say, they're not usually like leaning against the walls. Usually, like, a lot of them lay on the floor as opposed to lean against the walls. They do sit against the walls, but I yeah, the thought process, you guys. I hope everybody listening just made that face when they thought about it, and they were like, no. but like, to include like the ones on the walls in the gym, right? Like, when do those get cleaned? Is there a cleaning schedule? I don't know, but it was on the list of things you clean on the Safe Sport Award, because Nerd went through all the checklists, was like, oh, okay, how can we fix that to meet the standards?
Yeah, so see that Safe School Sport Award, nailed it. For some additional ones, and Amy popped in your hydroculator ice baths. How often are those cleaned out? Do we have a schedule? Are we documenting that? Because if somebody gets an ice bath and then they get an infection from an ingrown toenail or an open wound, like, can we verify, hey, we've been cleaning this, it wasn't us?
Even the ice machine. How often do you clean the bin of your ice machine? How often do you replace the filter? Do you know there's a filter? Because there's a filter.
I will say it's a great rehab. If you have anybody with an elbow or shoulder injury, have them empty the entire ice machine, and then you clean it, and then you just turn it back, and their shoulder will be like, I'm dead. It's great rehab. I will
I
say.
need you to know that I had a student one time. His first day, I just happened to be the day I was cleaning the ice bin. And like our initial meeting phase was, hey, can you hold my legs? I got my clean the bottom of the, like, because it was deep and I had to crawl in there. And I was like, listen, somebody else has to be here. I'm gonna get stuck in the ice machine. So
Did he come
listen,
back?
he did. He's a great athletic trainer. I now work with him. He tells everybody about this. We had a good time when he was my student, but he all the time he's like, you want to hear about the first time I met Katie? Her feet were in the air. I'm like, this sounds so bad. But yeah, I had him hold my feet while I climbed into the bottom of the ice bin to clean it. Had to be done. Had to be done.
Yeah, you got to get it done. Okay, so we're going to jump over to what is supposed to be documented, and we already kind of touched on what we go, but we'll go a little bit more in depth on what we actually write. So this is from the NATA. It's the Documentation and Coding Guidelines from 2011. So first thing that they note is chief complaint. I think all of us get that. Kind of the most important part of the note. And then a history of present illness or injury. And this can be either brief or extended based on these guidelines. A brief health history of present illness. Goodness, I'm going to say HPI from now on is 1 to 3 of these, and an extended HPI is 4 or more of these. And it's location, timing, quality, context, severity, modifying factors, duration, associated signs and symptoms. I would say we always get a brief HPI. Sometimes we get an extended HPI depending on the severe or the complexity of the injury. But Katie, are you typically getting a brief, like 1 to 3 of those, or are you always getting an extended history of present illness?
If it's a true injury, I'm hitting all of those. Sample OPQRST. Got it. Boom. Covered it. If you don't know that acronym, then
how did you pass the boards?
Yeah, I don't know. I don't know how to help you, I guess. I don't know. Who, what, when, where, why? Like, I don't know how to make that any simpler. This is your basic history. I think it needs to be covered. I mean, if there was nothing in one of the categories, you can just say nothing. But I feel like this is like the bread and butter of how you make your diagnosis. So why are we not asking all the questions?
Yeah, most of the time when you get through your history, you have your diagnosis like 95% figured out. I think for like a treatment note, the brief history is kind of, we only have a couple, but
right. Yeah, or when you have those kids that don't actually have an injury, like Ashley talked about, like that's why I have the brief history, and it's like, this is what they're saying, or what's the word? Not innate. Insidious onset. Boom, covered it. Insidious onset, pain 4 out of 10. You're like, why? I don't know. Insidious.
Looking at this, and I'm coming your way, Ashley, looking at this, a brief HPI, when I first did this, I was like, okay, yeah, you're not hitting everything because it's not relevant. As I'm looking at them more, I'm like, these are all relevant. I would say every soap note I hit 4+ elements, so I do an extended HPI. Are you kind of in line with that as well?
Oh yeah. Yep.
Yeah,
especially if they're big injuries. If they're big injuries, you're definitely hitting all of those. If they're are small little ones, then I'm probably not hitting a lot of that.
You know when I don't hit them? Emergency.
Yeah.
Because I'm like, boom, this is whatever it was. Mechanism of injury, initial observation, boom, 911.
Yeah.
Then I'm stabilizing, and maybe I'm probably getting vital signs. I'm probably like maybe doing some of them, but there at some point it goes, stopped doing anything, stabilized, waited for help, or whatever, It suddenly, your history suddenly gets shorter almost sometimes with emergency
scenarios. It just goes to
scenarios.
severity.
Right. It does, because you're like, ooh, this is a medical emergency. I did not do right. The rest of your note for sure. The OAP becomes nothing. It becomes wait for doctor response. It's like your history. Here's the thing I will tell you, document every little thing that you know about it, the emergency, before you finish your note, but it becomes shorter.
Yeah. So I think we usually hit the extended on that one.
Yeah.
The next thing that they note is a review of systems, and there's 3 levels to this, and I think we hit the middle one almost every time. The first one, which does not seem, I don't know how you would only hit this one, but pertinent review of systems, which would be 1 system. Extended would be 2 to 9 systems, and complete would be 10 systems. So the systems are constitutional symptoms, so fever, weight loss, eyes, ears, nose, mouth, and throat are all 1. Cardiovascular, respiratory, gastrointestinal, genitourinary, musculoskeletal, integumentary, neurological, psychiatric, endocrine, hematologic, lymphatic, and allergic, immunologic. I almost made it all the way to the end without.
You're doing great.
Thank you.
Sped
I was
through
proud of
those.
myself. I did. So I think every single time they walk in, we're at least getting the neurological and the musculoskeletal every single time. So
And
that's
skin.
Well, yeah, I'm just saying the bar is 2, right? So I think every single time we're at least getting 2, most likely more, because yeah, we look at the skin almost every time. So I'm not sure if we would ever. I mean, I'm sure we would get it, but I feel like a complete review of systems is like a physical. Like I don't know if I'm ever going to check all 10 for an injury.
No, only as they apply. Depends on what you're dealing with. Yeah.
Yeah. Katie, you got eyes squinting. What are your thoughts?
Well, I was trying to think of if you had like a kidney lack or a spleen lack, like you probably hit all of them in that. Maybe I was trying to think of what athletics injury could hit.
All of
you
them.
know, because you might have constitutional symptoms with that, but you're not hitting, like, I don't, if you have jaundice, you could hit eyes. I don't know if I can get ears and nose and mouth in there, but your cardiovascular system, you're going to have a heart rate change with that. You're going to have breathing. Your gastrointestinal system might be upset for sure. Genitourinary, if it's a kidney lack or a liver lack, maybe, because you'd have blood in the urine.
I can see us hitting 9.
If you have psychiatric response aside from the. Yeah, I'm trying. Yeah. I'm really trying to get to all of them. I was trying to think of what injury could cause all of them, and I'm just not sure I can. We are not car accident assessors, so.
Right. That while I was going through this, I'm like, I mean, physically, you're going to hit all of these, but in our day to day, I'm not sure if we'd hit any more than extended.
I think you're doing a full trauma assessment if you're doing all of them, and that's.
Yeah. So yeah, I think we always end up in the extended. Honestly, I think if we're in the pertinent, we're probably not looking at enough things. So we really shouldn't, unless it's like follow-up. Maybe follow-up would be, we're just looking at musculoskeletal, but even then we usually ask, okay, still no numbness, tingling, or still no sensation change. So, yeah, so that one's pretty quick and easy. Ashley, any thoughts other than what we just chatted about on that?
Nope.
Perfect. Okay. The next one is a past family and social history. I don't think we hit this one enough based on my experience. So pertinent PFSH is 1 area versus complete is 2 or more. The criteria is past history. So the patient's past experience with illnesses, injuries, surgical procedures, and treatments, family history, and then social history. We always hit past history because it's always relevant. I don't think we hit family history or social history as much, but
what do you mean? I hit it all the time. My dad has bad elbows, CJ. I gotta
say,
it's my favorite thing that kids say. They're like,
that's a good point.
Well, my whole family has bad knees. I'm like, oh, okay, let's look at the anatomy of your knee. But like, your knee injuries tends to not be genetic, like chronic I guess stuff. Yes,
I ignore
but, like,
them.
The
but
acute knee injury is not often, like, the amount of times where I have to be like, listen, they didn't pass down ankle sprains. I assure you, that's your own body.
I stubbed my toe. My dad has bunions.
Why are you blaming your dad for your ankle sprain, buddy? Like, let's take it down a notch.
Ashley, do you ever hit social history? An age-appropriate review of past and current activities?
And well,
I'm saying yes, she does.
I'm getting stuck on the age-appropriate part because that can factor into a lot of things. So
we've talked about this on other episodes before.
Yeah.
How much have you grown in the last year?
Exactly.
Boom,
that's kind of the thing. Yeah.
I can
Or
tell
how
you
old were
Ashley
you when this
does.
problem
Yes.
started?
Yes. So
Yeah.
she may not be able to think of it off the top of the head, but I know she's asked that question before.
I
So
just
yes,
think
she does.
social history is a weird way to
Right.
say that.
It
I know,
is.
yeah,
I was
it
like,
is.
is this who they talked to?
Yeah.
It's
What
actually
what
it's
group are
when
they
their
running
friend
with?
brings them in and demands they tell you about their pain.
I
Or when
love
the
that.
whole
Great
team
friend.
gets Osgood Schlatters because it's contagious.
Yeah, you
Right.
guys didn't know that?
Yes.
Yeah.
Yeah.
You guys, I want to tell you about when I worked gymnastics and the 7 to 9-year-old girls always thought that taping was cool. So everybody had plantar fasciitis. All of them, every single one.
Ugh. Okay, so I'm saying we probably hit 2+ areas every time, whether we mean to or not. Um, okay. Do we document that though? Do we put that in our notes? Because
If
that's
it's
what we're talking about.
if it's pertinent, yeah.
Yeah. Katie?
But if it's not pertinent, then I'm not gonna say
Yeah.
ruled out family history. Like
Yeah, I
Yeah.
can't say that I say yes to that all the time. Shoot. That
Yeah,
I
maybe that's one of
actively
the
put it into my note.
maybe that's one of the kind of shortfalls that we have is I think we do very good evaluations. We cover a lot, but the question is how much do we translate to that documentation? How much do we deem
Yes.
as relevant? But and that's why I think templates come in to help a lot because you can have it on there and you can be like, oh, I did talk about this. Yeah, I'll jot something down. Or, oh, no, I didn't address this. But yeah,
Thank you for bringing me back to being in my athletic training program and having to remember documenting what I observed. Now I feel like I'm in that situation all over again, where it took me forever to be like, but did you look at your patient? And my patient is my friend who has never actually had an injury on this body part. And they're like, did you document redness, swelling, bruising, discoloration, deformity? Did you look and see if there was a deformity, Katie? Because you didn't say that out loud. And I'm like, oh, man. Because when you do it in real life, you can see that there's no deformity, and then you remember to document that. This is where we're at again for me.
Mhm.
Thanks, CJ.
And I think we always like look at it and we're like, okay, there's nothing of importance, and then we move on. But documenting that there's nothing of importance is important. Ash?
I do often document like no physical signs or no visible signs, especially if they're like, man, this hurts so bad. And I'm like, I don't know why, because I can't see anything and all your special tests are negative. So I will document it when it seems pertinent.
Right, but how long did that take you to learn when you were in your athletic training program? Because that's where I'm at with it. It took me I do now, but when I was learning it, I would forget. That is what I would forget to document when I was in my program and learning how to document. Was I would forget to write down the stuff that I did not see. Right.
Yeah. I think that one is it kind of I think about that one often, and I think I thought about that one a lot when there's nothing to see.
Mm-hmm.
Because I'm like, well, I don't know. This is playing a factor in my decision making, and I'm expecting to see something, but I don't.
Well, it's kind of like with the ABCs when you run on for an emergency. You're not actively thinking, is there airway? Is there breathing? Is there circulation?
Right.
Circulation, you actively think about because you check it. But like they're screaming, cool, first two are good.
Yeah.
It's kind of the same thing. Hey, I don't see any bruising. Like it just doesn't come into your brain a lot of the time. I've kind of gotten in the habit of doing it. But Katie, I feel your pain. I apologize for bringing it up. After our last episode, I texted the group. I said,
now,
I just did an entire
I
note.
was just
going to
say
30
that.
minutes.
I was just going to say, now I will spend the next month making sure that I document that in every single note because that's how my brain is.
They're like, why is the efficiency of these 3 athletic trainers just going so far downhill?
Right. Why does it take you 3 hours to do your documentation now, Katie? You used to be like at a solid 30 minutes. Yeah. Because now I have to put this social history in.
Yeah. So these are the documentation for coding guidelines, right? So when we look at it, just a little bit of background, there are 4 levels for physician evaluations based on the above criteria. It's problem focused, expanded, detailed, and comprehensive. And that's basically based on how many things they hit here. Athletic trainers are limited to 1 code, which is evaluation 97005 or reevaluation 97006. So while these are guidelines for coding, it's kind of something we should be striving to get to because it's best practice to have these things in there. But I think probably more relevant when or if billing for insurance comes into play, but that doesn't mean we shouldn't add these in because these are the NATA guidelines. So is it realistic for us to consistently meet that documentation standard for those coding guidelines? as set by the NATA with the current model in the secondary school setting? Ashley, I'll go to you first.
No, absolutely not. That's
Katie,
it.
anything to add on to that robust answer?
I think it's realistic that we can meet them until we're paid for it. I don't think you're going to convince everybody to do it. I think that's the realism of the answer is it meetable? Yes, we just discussed that we do it as part of our eval all the time, which if you don't write it down, it didn't happen. So here we are in a situation of saying if you get sued for it, it's not documented. And EMRs make it pretty easy to get all of this in there. But are you going to convince everybody? How many patients am I getting paid for to do the eval documentation on every day? Because some days I write one full eval note, other days I write 8. So how am I getting paid for this? What is
Yeah,
the
your pay stays the
reimbursement for
same.
it? What? Yeah. So
Yeah.
I
Well,
don't
like we
know.
talked about last episode, is
Build a
chicken or the
template,
egg.
make it easy. Yeah.
Yes, templates they will help you a ton in this, but it does take a little bit more time. So
But hear me tell you, yes, you should do it, regardless of whether it is easy or not easy. You should do it because it will save you in the long run, and you will hopefully in the future see something for it. I don't know.
if the scare factor is not enough to save your hide in the future, consider it a part of helping to move our profession forward, just trying to get some
Right.
better note taking, right? Because it helps in the long run. It really does.
Or you can side eye me like Ashley did, and
Oh, she's been side eyeing hard. She has turned
listen
away from the camera just to
I
side
can
eye even
hear
harder.
every athletic trainer that's like, Katie, I hate you right now. Just because you're an overachiever, don't make the rest of us do it. And I understand it, but I'm gonna stay on my nerd grind and keep doing it my way.
I mean, progressing is not easy. Like getting better and doing like holding ourselves to higher standards is not easy. So I understand it is frustrating, and especially when we don't see anything immediate. I think our society is very much of an instant gratification, and it's hard to do something that's going to benefit us years down the road. But it's kind of something we should start working on, even though it is more difficult. So now that we've thoroughly made everyone listening angry, let's go ahead and move on to section 2 of values of documentation. So hopefully we can get them back on our side by showing why it's important to do this. So we're going to start with fear factor because that's kind of what I remember the most from college. Is you will get sued no matter what you do. You can do everything right. You will get sued at some point in your career. It's pretty much what the main thing I remember from my schooling. So benefits of documentation, biggest thing is legal protection. You don't have to. I think this part is super important because this is kind of what I stress to my students all the time. You could be a perfect athletic trainer. You have done nothing wrong and you can still get sued. You do not have to be in the wrong to get sued, but you do need to be able to prove you did nothing wrong to win the lawsuit. Getting sued doesn't mean you did anything wrong. It just means someone thinks you did, and then you need to be able to prove that you didn't. So your documentation really can come into play there big time. Katie, have you ever had an experience where I think you mentioned it last time, where you had documentation where you didn't do anything wrong, but your documentation provided that protection and then you were clear?
I've never been sued, just to be clear. I don't actually ever intend on being sued, just to say that. Like, I don't know, CJ. I
Not
don't
in the
actually plan. It's not in the plan. It's not actually on my list of things to worry about. But I have a handful of times had an athletic director come back to me and say, do you have notes on this? The parent has made a complaint, or whatever the case was. And yes, I did in fact have a note on it and did in fact list all of the information that was needed for the parent to say, oh, okay, never mind. We at least got that far. I've never had anything get past that point.
Mm-hmm. Yeah, same for me. How about you, Ashley?
So I have two, and I'll kind of talk about briefly. I've never been sued, but I was working at an event where a soccer athlete ran onto concrete and slipped, obviously, because of the cleats. Like turned in midair and smacked his face on the cement and lost a tooth. And the parents tried to sue the district for that injury. And so because like even as it was happening, the dad was yelling that he was gonna sue and like who's responsible for paying for this? Because I told him I was like, thank goodness someone saw the tooth bounce. So here's the tooth. Like, but you should probably go to the dentist right now. And so they were really upset about who was going to pay for it, but I documented it really well. And even my athletic director was there and he was freaking out. He's like, "Oh my God, we're going to get sued." And I was like, "No, like you're fine." Um, but so my documentation helped the district then fight it. But I like nothing was bad with me because like they weren't complaining about me. They were just complaining about the field, I guess.
Yeah, what was the complaint? I'm curious in that
I
situation.
think it was unsafe field conditions. And I
Okay.
was like, well, when your kid runs 20 feet out of bounds and onto cement, like how
Yeah.
yeah.
But that's a great example of like the field wasn't unsafe and they were threatening to sue, but
Yeah.
there wasn't really anything with issue there. Katie.
I have two things. I'm going to try to remember.
Oh, is that why you
both
have
of
both
them.
hands up?
Yes. Yeah.
Okay.
Just to remind myself which question is on which hand. Field safety falls under our purview, correct?
Mhm.
So like, like when do you document that the field was safe for play? We talked about it a little bit last time about documenting the weather.
I think you
But
just document when it's not.
right. Right. But like, I don't know. It's funny, not funny. Hopefully I don't get in trouble for releasing this information, but it's part of our policies and procedures to check that people read them. Yes, I did read them. I think at this point, if you don't know that I'm that nerd, like we got to clarify I am that nerd. And they like put a line in our policies and procedures that fields need to be checked for rattlesnakes, just to like see who reads it. And I was like, I'm not doing this. I was like, I'll tell you this. Anywhere on campus, if there's a rattlesnake, we're not playing that day. How about I just say that? I'll just cancel everything. It's not safe for anyone. We can't even go outside the doors. We all need to be in the building. I don't care. Like, boom, done, covered it. But like, I don't know how, like, I've covered at a middle school where the jumpers pit was way too close to the turf field. And I had the same type of situation as Ashley, where as soon as the opposing player went down, he hit it, went down, whatever. At that time, the parent was more upset with the official than he was at the field for the proximity of that. But like, middle school turfs are not built for whatever, but like I don't know how to document that. So thought process on that documentation and all of that such. But then my other side, back to this hand question, where do you keep your documentation for grandma and grandpa that get injured at the game that you were covering and for sure they're calling you? Because like you guys know where I used to work, and think about the stairway and that going all the way up the bleachers of those permanent bleachers. I had someone, grandma, fall all the way down those bleachers. Like, what am I going to do? Not run over there to help? Like, again, probably outside my scope, but like I was working in an event, I was contracted to work that event. Like, where does that documentation go? To me, I wrote it up and I emailed it to whoever was paying me for the event that day, just to say, here is what I know about the event. And I got no follow-up and no nothing from it. But like, just a thought process of documentation and on your own, and where do you save that? And like, so for the school, you said you have to send it to like a district person who gets it and handles that side of things. But documentation, legal, go.
Yeah, no, that's a really good point. And I keep a running, again, probably not the most secure, but I keep a running Google sheet of external things that I've treated or looked at for exactly that kind of thing. Like this parent fell down the stairs at the bleachers. That just happens so often. And hey, I checked in with them. I only got her name, but they refused care. She was okay. She walked away under her own power, kind of stuff like that. And then also for those types of incidents, I do also email like my athletic director and like the facilities manager, and I try to loop in anyone that might need to know about it. And yeah, often they go nowhere. I don't get any responses, but I did my part. Like I'm trying to help you guys. And then yeah, it stays in my Google sheet. So
This might be a dumb question, but if we're operating under Good Samaritan, it does what does HIPAA look like for that? Because
You're responsible to the highest license you hold, though. So
yeah,
like,
so it
if
does have to
you
be HIPAA protected.
like,
But-
abandonment is a real thing. Even if
Yeah.
you're a good Samaritan, you have an education and a license, and if you abandon your patient, like you can still, like, that is a major spot for liable. So once you start to help, you now can't pull back on it until someone more qualified than you arrives, because I I will say this, CJ. I don't think any athletic trainer functions as a good Samaritan. You are still a first responder no matter what you do. I don't
Mhm.
care. You're not a good Samaritan. You have an education and a background that says you have to abide under a scope of practice. Unless you are incapable of making decisions, in which case, take yourself out of it. Do not be under the influence of anything and trying to help in any situation.
Yeah.
But outside of that, you have a scope of practice you have to stick to. If you involve yourself, you cannot uninvolve yourself without doing it appropriately. Therefore, everything should be documented.
And I like, Ashley, what you're saying about the Excel. I like using that for like the non-medical stuff, like field checks.
Yeah.
Check a box, keep a running tab of date, kind of like they do with like bathroom cleaning. They have like this was cleaned on this day, yada yada yada. I like that. Interesting. Another benefit of documentation, I think, is communication, which I think this is one of the key parts. We touched about it in one of the barriers in last episode. I think most ATs don't communicate as much or as well as we could, and there's a lot of factors which we've already talked about for that. But is this something that we need to improve upon to be able to see the benefit increase in documentation? So if I'm communicating, like in my position, I work with multiple athletic trainers every day. So my documentation has to be pretty good because I'm leaving and they need to know what's going on. Whereas if you're the only person at a school, you're documenting and you're really only communicating with yourself for the most part, unless you're going out to a PT. So Ashley, do you think that communication key, if we start communicating with other ATs more often, do you think we would see a resulting rise in documentation quality?
Oh yeah, absolutely. I think so. And the more we have to collaborate with other athletic trainers, that's hopefully naturally going to also improve as well.
Mm-hmm. Yeah, I like that word, collaborate. Katie, how about you?
Yeah, I do. I think collaborating with any other professional makes your documentation better. I would say even if you're not thinking other athletic trainers, if you're like, nope, I'm never going to get there. I'm always going to be by myself on an island, but you're still communicating with your coaches. Do you have a running list of which kids to tell your coach about? Like, I mean, maybe that's just me and the only social interactions I get, or if I go out and walk the fields and talk to my coaches. But like I'll go out and be like, "Hey, I saw these 4 kids. This is what's wrong with them." And like even that, like if if I don't have that list and then they're like, "Hey, what did Susie have wrong with her today?" And I'm like, "Who's Susie?" And then we have a whole right? Like that's that's poor communication, right? So it helps. I think it helps with everything. Again, sign-in sheets matter. Like I'm like, oh yeah, Susie's a soccer player. I need to go talk to the soccer coach about her. Like that helps improve your own documentation too, because at least you're saying, hey, head soccer coach, I saw these 6 kids today. And then as your bandwidth expands, you can expand that to the lower level coaches or the softball coach or whoever that maybe you didn't see that day, to help with that.
Yeah. Ashley, any final thoughts on that?
No, I agree. Katie's amazing.
Yeah. I think that's what we're all learning from this
Years.
podcast.
This
Katie
takes
is just the
years. It
model.
takes years, and you have to be a terrified nerd who's like, oh no, I have to do that too now. And then you find an easy way to get around it. You guys, Google Sheets and QR codes and check boxes make life way easier.
Mm-hmm.
And then when you get to a point where someone's like, did you check the air quality today? And I'm like, oh yeah, that was on my list of things. Here it is. Yes, it's safe to run today. You do that out of years of practice, or someone being like, no, we actually just depend on you to do all these things, and I don't like to do things wrong.
All right. Going to the next benefit of documentation. I think this one's probably the biggest, or as the most value. So before we go into this one, worth versus value are two different terms. So the NATA secondary school value model from 2021 defines both of these. And I think we use them interchangeably a lot, but want to kind of throw out the actual definition. So worth is the monetary value of a service. If I tape an ankle or if I do an evaluation and insurance deems it's worthy of this much, that's the money that I'm getting back for that. Value is the extent to which a service's worth is perceived. So I might only get $15 for taping an ankle or doing therapeutic exercise for 15 minutes, but the family might value that way, way, way higher because of all the extrinsic stuff that comes with it, where I didn't have to take off work to go to this and to blah, 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 blah. Right. So value and worth are values, how much people perceive the worth of it, and worth is the monetary money dollar value. So, the biggest question, and Ashley, I'm going to come to you first because I have a feeling if I want to let Katie stew on this to really get her riled up. So I'm not going to go to her first. So we're coming your way. How do we make the school or community, how do we increase their value of our services, or how they value our services? Because a lot of it, I think, is, they're getting coverage to decrease liability. Isn't that enough for us to provide? Why would our documentation lead to increased salary or any of that stuff if they're paying for us to cover events and decrease the liability on their end? And yes, to care for the athletes, but when they have very real budget constraints, how do we increase that value to then have it translate into an increase in worth?
My initial thought, you're not going to like. My initial thought was, how do we make them value us? You stop showing up like to stuff that they don't tell you about, and then they're going to be like, oh dang, where's the athletic trainer? And you're like, maybe you should have told me about it. Like, you need to value me a little more if you want me to be there for you. And that's not a super great answer, but it is something that,
but you're not wrong.
Yeah. If we constantly bend over and coddle them, they're never going to perceive our value correctly, because it's very easy for them to overlook us when we're just constantly there getting done for them. Sorry, I cursed.
Amy, this is a great time to use the beep.
Amy, you're going to have to bleep that.
My bad. But if we instead help show them that us being there, there's actually a cost for that. That might help. But and then of course, documenting everything we do. And no, we don't bill insurance for our CPT codes, but that is the number one way that we have been trying to show proof of the cost of our services over the years. Is we've all been like, okay, document as much as you can, document everything you do, so that we can pull up that report at the end of the year and say, our athletic training group did $5 million of services for free. Like, basically,
that's
for no extra cost.
Got. Yeah.
Yes. So that also helps, absolutely, because it shows a monetary value for us, a monetary worth of our value. But yeah, there's no short answer there.
No, this is a heavy question for sure. And I think we kind of talked about this in the part 1 too, is I think we've gotten so good at our jobs that it's not so much taken for granted, but it's kind of like, we are getting all this stuff done anyways, and you're so good at it. So why should we change our mentality?
Yeah, and I also think this makes me think of a story of another athletic trainer I know. And when they left their high school realized how much they did for them, and then accused that athletic trainer of sabotaging them because they had no idea how much that person did for them.
Should I unmute now, or should I?
Yeah. So that's one way to not show up.
I was just gonna say, so I did that. I walked away and proved my point, I guess.
Yeah,
you show the value of an athletic trainer. Show the value of your athletic trainer really well if you do all of those things and then just disappear in a day. I'm actually not super triggered by this question, as I prepared to be when CJ said that. I will tell you, if you are a good athletic trainer, people know your value. Here's what the opposite side of that discussion is you should ask people what they think your value is. When I left, people thought that my starting salary was $90,000. And I was like, oh, let me introduce you to the average salary of an athletic trainer in Colorado, because that is not what I was making. And they very quickly understood why I left. So there's that. So there is an understanding there. I think it's very important. And I started doing this a lot, and I do it now at the position I'm in. The cost of the lawsuit is a preventable death lawsuit, which is truly, like, let's be honest, that's what we're here for. We're here to prevent injuries, but preventable death is like really high on the list of what athletic trainers are here for. The starting bid for that is $10 million. So the payout is minuscule compared to what the cost is going to be, because at this point you're losing all of your athletics programs if you lose that lawsuit because of all of these things that your athletic trainer does for you. Um, the value of that, yes, day to day, if you work for a hospital system, they better be tracking it for you, but you can track it yourself. I used to just keep a running list of, here's the kids that I sent to the doctor, here's the list of them that had surgery, and just you can Google the approximate PT appointments that they would have for that, the approximate follow-ups, whatever, and then you can document your own and outcomes that you had from that, right? If I've had an ACL and she never had a re-injury, like my return to play percentage is really high and really great. So I'm documenting no re-injury occurred with this ACL that has a really high recurrence of injury with it. Your value is very well shown. And I do think I have an intrinsic value model that's way higher than my extrinsic value model. Like when a coach comes to me and they're like, you're the best athletic trainer ever, I take that to heart way more than I worry about what I'm being paid for it, which is a problem. And I recognize that as far
I think
as
that's profession wide though. Like
yes.
everyone values
So
positive feedback.
so I like my worth, I'm really bad at showing that. But value wise, like I'll tell you the amount of people who reached out to me and the nice things that were said to me, like I know my value is high. Also, when you move to a new place and they all know your value before you get there, it also helps a lot too. So there's that. I'm not suggesting everybody quit their job. I'm suggesting be really good at your job and make friends with all your coaches and be a part of that family.
Yeah, I think every single athletic training facility I've ever been in has stuff plastered all over the walls from their athletes and coaches saying thank you for everything you do and you're the best and blah blah blah. So we all value the value. We all value like people's feedback. I don't know how to say that. How, Katie, I'm gonna throw this one your way. Does demonstrating your worth increase that value, or is that value already high enough? And how do we use that to help us operate how we need to operate rather than how people who contract us think we need to operate?
So I think this is I'm going to derail us, CJ. This is what's going to happen. You did this. It's not my fault. I'm just saying this is a business argument. Athletic training is healthcare. It's athletic training every day, but this is business. When you're talking about value and worth, you're talking about business. You now have to put on your MBA hat and say, okay, as far as a business model goes, what do I have to do for the CEO or the CFO to understand what they're paying for? Because I can promise you that the CFO does not care who you are or what you do, and they probably have no idea what an athletic trainer is. Even at colleges, the CFO, the chief financial officer, probably does not know the details of the job of the athletic trainer. So when we are talking about showing your value, showing your worth, that is who you're talking to. And now you have to do it in money standards. And this is the part that nobody wants to do, but we've been talking about it the whole time. And it is detailing all of the things. Track down the CPT codes, put them next to your notes. You have to do it at the end of your year and roll out what you guys said, that financial coverage of what you've actually done this year. So here's the problem. If you saved all those people that amount of money, those are all interconnected families that don't care separately, right? Like I saved this family $5,000. I saved this family $10,000, right? Like that's a hard model to understand because it's so intangible. So you have to find tangible items for them to understand. And it's okay, well, how many of you talk to 40 people in a half an hour? Like when you do your job, here is my list. Google Sheets keeps a timestamp of when they signed in, as long as they didn't sign in at 6:30 in the morning. Ignore that part. But I recognize I said that earlier. But these 45 kids signed in from the time frame of 3:30 to 4:30. How many people in their normal job have to talk to that many people in that amount of time, right? And then you go, okay, what's the coach to athlete ratio? What's the admin to student ratio, teacher to student ratio at a school? If you start talking in this way, you're going to win the argument more. I don't know that this belongs in the documentation section
No, no,
of what we're talking about, but this is how, like, those are the things you talk about. You have to put your business degree hat on first. Of all the hats you wear and all the extra certifications you need to have, business needs to be in the back of your mind, because everything else is based on our feelings, and those don't matter to a CFO.
Yeah, we're kind of getting a little bit into the
I told you I'd derail
no,
us.
no, you're fine, because actually it leads straight into the next bullet point, so that's
Yes.
good. Documentation is not just a medical side, but a lot of times, like Ashley said, we use it to help increase our value and worth. And the NATA secondary school value model says that showing the data and outcomes of athletic training services creates an opportunity for others to better understand the scope of healthcare provided by ATs, which is kind of what you were touching on. And they say that it will lead to value added services. My problem with that is I think we've all kind of agreed, like, our value is high. The problem that we're having is we have a high value, but the worth does not match what that perceived value is. And they talk about documenting decreased absenteeism, decreased lost game days, increased participation in school, decreased parental concerns, and increased student athlete plan compliance. And those are all things that we should strive to document, but that's really hard. And then how do you tie that into the worth, and how do you make that match? So I think it's a very deep conversation of that documentation, how it ties into everything. Ashley.
How and where would you document that, CJ?
I don't know. I'm just here to ask the questions. You guys have the answers.
Well, you would document it in your crap. You guys don't hate me. You would document it in your value model that you keep a running track of why do I need a raise next year? Oh, because I also did X things. And then you have it to show. I'm sorry. I'm sorry. Listeners, I am sorry. I don't.
So yeah,
Yeah,
it's goes back to having a like a running sheet.
Yeah, it's your
Of all of
personal
this
documentation,
information.
because
Yeah.
I mean, if here's the thing, if you don't care, I don't care. Like, if you're not trying to get yourself a raise, I don't care if you try to get yourself a raise. But I care, and I'm trying to get myself a raise, and I'm trying to prove that I am the best athletic trainer in the state of Colorado. So here we are.
Yeah. This just highlights the fact that documentation is not just the medical part, but there's other things that we need to document to help move our profession forward. Last thing I'll touch on pretty quickly. So when you're doing all this, it's going to take like more time. Like I said, I texted the group and like, I just did one note and it took me so long. Like, oh my gosh. And I feel like I'm pretty like good at doing my notes in a quick time pretty thoroughly, but everything we talked about last time, I was like, oh, this took a while. So one thing that you can kind of use to flip your mindset of, hey, I'm slowing down my ATF and my care because I'm doing more documentation. It does force you to slow down, and it forces you to think a little bit more, which is nice when you have the time to do that. It's not so nice pretty much in everyday life in the secondary school setting. Um, it does cause you to think about that efficiency, and are you doing what's best for the athlete, or are you kind of just doing something to keep them busy until you move on to the next one and can come back to them. Because I think we've all given those, like, if you're doing rehab or if you're have an athlete who's like, hey, I'm done, and you're like, okay, just do this thing, and it's basically a time for you to tape an ankle, think about what you want them to do next, and then you can continue on. So it does kind of force you to slow down, and I think the hardest part of this is, and I'll always come back to it, is how do you justify this to coaches and admin when you're trying to be better about your documentation, but you're inherently slowing down in the ATF. Katie, you seem to be really good at documentation. Have you ever had that issue where maybe you come into a new position or a new coach, and they come from a high school where the athletic trainer, boom, 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 everybody out fast. And then it's a little bit maybe slower in your end because you're having the rehab. And how does that conversation go of like, hey, yeah, it's going to take them 5 minutes longer to get out, but here's the reasoning. How does that conversation go? Or do you just get everyone out and like...
You've never seen me go through a taping line before, CJ. I worked at a 5A high school that had a ton of athletes, and I'll promise you I'm a fast ankle taper. No, we do taping first, and my documentation for taping is all in the they were taped category. And I just tell them, like, if it's right after school, it's nope, we're doing all taping first, boom, boom, boom. If they need rehab, you go talk to your coaches ahead of time and you say, hey, they were in here for treatment. My minimum start time for after school taping is an hour after school gets out, right? And then we start rehab. So if they're late to practice, you decide how you want to handle it, right? Like, I've had a coach come in and be like, why aren't they getting out here till this time? Okay, well, because they couldn't practice in the first place. And so they were sitting in the athletic training facility for that long. But usually what happens is I go to them and I say, listen, what do you want from them first? Do you want them to come to meetings? Do you want them to come to this? Do you want, right? Like at football, at one point, we had offense got taped before, defense got taped after meetings because meetings were after school. And then practice was like, I don't know, 30, 45 minutes after school. But so half of the football came in before, half came in after meetings, which then allowed for more time for the in between of the other sports to be able to get taped and get them out to their practices as well. Because if you haven't been accused of prioritizing football, you're probably not an athletic trainer. That's not usually the case, but they are pretty pushy. And for whatever intimidation purposes, the football team always pushes their way and it gets taped. The girls get really good when you tell them to just push the boys around. They'll tell them to go sit over there while they get taped. It's great. Anyway, these are things I've learned across a long time. But it was great when the offense would come in and get taped before soccer, volleyball, cross country, softball, what I don't know what list the fall sports would all get taped in while they were in meetings, and then defense would come in after and they'd all get out to practice on time. And then whoever needed rehab came in after, or they came in after practice. And that was a coaching discussion, right? Soccer, they knew they were allowed to sit in there for as long as they want because soccer knew I would come out and talk to the coaches after I got done doing everybody's rehab, and it would be the end of practice and they'd be like, how long was this person in there? And I'd tell them what we did for that day, and that was all they needed to know. um, we got to a point where kids knew, like, hey, go check in with your coaches first and come back because I'm taping. If they need you, then you can get that done and come back in for rehab. And it's just, I think it's just communication with the coaches at that point about how you're gonna handle it. And then I did if I could document while I was doing treatment, I would. I'm a document after type of person. I'll make myself notes if I need to. Again, I told you on the last episode, I have forgotten what I've done with kids before. And then I recognize that I'm overwhelmed and overloaded that day and I need to find a better way to refresh myself. But otherwise, this is why the sign-in sheet matters, is because that's how I remember who I saw that day. And then I know what I did with them. Rarely do I go in the next day and try to do it, but I will leave myself notes if it's hitting 8:30, 9 o'clock at night and I still need to get it done, then I will leave myself notes for the next day to put it in. But I also, at this point in my career, know what my eval skills looked like. So I can say oh yeah, I know I did that, and breeze through it.
Yeah. I very much agree with Katie, but instead of I feel like I typically don't have time to go ask the coach what they want. So when the rush after school comes in, I'll be like, what do you need? What do you need? What do you need? What do you need? And then I'll be like, okay, you and you go sit on that table, you and you. I'm going to be a while because you're probably not practicing today. So I need you to go talk to coach and see what you need to be involved in and when you're allowed to be in here. But go check in with coach right now and let me know how that goes. So that's what I tell my kids.
And if you need a reason to go back to that CFO and ask him, invite him to your athletic training room for 5 minutes after school. Say, just come sit for a day, because if you need to see how many contacts there are in that amount of time, come sit in here for a day with me so you can see what the value model should look like. Because somebody who sits in an office or a cubicle all day comes into the athletic training room, it's an eye-opening experience for that sheer purpose. Do you know how many times I'm like, everybody put your hand on a wall? Also, quick tip for athletic trainers. Everybody put your hand on a wall so you're not touching me while I'm trying to tape. Stop getting closer. I have a bubble. Get out of my bubble. Everybody's hands have to be touching a wall so that you're not near me. And then I've done this with a supervisor person in a room, and they're like, oh, okay. I see how the chaos gets controlled now. Sometimes you get overwhelmed. That's how you control it. If they're touching a wall, they can't be touching you. So, but that, it shows your value, because they're like, oh my God, how do you control this many people? There are 9 programs and you are controlling all of them in the 30-minute span that happens after the school bell rings.
Yeah, I love I love that you said that, both Ashley and you, Katie, hit that the athletes can come back. That's exactly how I always managed it. Was everything's a little bit slower because I'm going a little more in detail with the rehabs. The taping is just boom, 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 get you in and out. But yeah, when I'm taping, I'm like, why are you sitting here waiting to do rehab? Go ask your coaches what they want you to do, learn, watch, and then come back at this time. I'll be done and we can start getting the rehab done. That way they're at practice and then the coaches know where they're going and it helps everything run smoothly. Yeah,
Also, I use the dynamic warm ups as the warm up for rehab. Go do stretching and
I
warm up
like
with
that.
your team and then come back, because why am I running you through a warm up? Go get your warm up in and come back. There's nothing happening. I mean, there might be some things in dynamics that they can't be doing, but they should do the warm up with their team and then come back to see me so that their body is ready for the rehab.
Yes, and you said that in a previous episode, Katie, so I started doing it and I love it. So, thank you.
You're welcome.
That'll cut down on your time a lot. I like that a lot. All right, so we're going to move on to the last section, section 3. A lot of this we've already kind of touched on, so we're going to skip some of the bullet points that we have on here. Just heads up, we'll touch on them very shortly, but we're going to talk about navigating those barriers to improving documentation, which is kind of what we were just talking about. So Welch Bacon et al. In 2018 cited that ATs describe spending 10 to 50% of their total work time on documentation, with most respondents spending about 1/3 of their total work week documenting patient care, which was helpful because 10 to 50 is a huge range. So about 33% of their total work week was documenting patient care. The problem that they cited in this was a lot of people don't track how long their documentation takes. So a lot of people are just kind of guessing, I probably spent about this time, which if you're feeling overwhelmed, you're going to say that's a lot of your time. If you're managing well, you're going to feel like it's not a lot, but it could be you're spending 50% of your time on documentation, but you're just really, really efficient. You've just got a lot of people. So is this spread accurate for you, Katie? Do you feel like you're about 33% of your week is documentation, or do you prioritize patient care and deprioritize documentation and are close to like 10%? I already know the answer for you.
I do not think I'm yeah, it's not even close. Here's what I'll say. I think the people who are spending the up to 50% of their time doing it, I think they are not spending the upfront time to get ahead of it.
Or
That's
they're
what
not
I'll
being
say. I
efficient.
think
Yeah.
yeah, you're doing and or you're overwhelmed and then like actually sit down and do it. So you're like, "Oh,
I
right,
can't remember, so it's going to take you
I
longer.
do have these 14 kids who I'm seeing pretty consistently, but outside of those 14, how much more, your taping is chaotic and busy, but then it calms down. And if you've got 14 kids in your athletic training facility all at the same time, it probably feels chaotic. But when you really get down to it, if you changed reps or sets that day, document it. But like, what did they do? When I look at it, I'm like, yes, my eval notes take me a really long time. My next day follow up notes are like, prescribed these exercises,
Mm-hmm.
said they're doing, pain scale is this today. I'm really bad at goals and short term and long term goals and saying if they've met them or not. That's my like quality improvement I'm working on. But when you sit down and do it, then it's not. I spent a lot of time. I built myself templates. I built myself the questions I wanted to ask. So you guys, at one point, I had a Google Doc made where it was like QR code, fill in the questions. It was the entire subjective history that I could just like copy and paste. And then what all subjective. So all I had to do was the objective portion. It makes your life really easy. So I spent the time up front to make sure my documentation goes real quick when I'm doing it during the school year. And it is no, I was being paid for the time. Why would I not do it during that time frame?
I think
Don't
this.
just sit and read a book if you could be helping yourself
Mhm.
for the fall season.
I think this highlights our perception of how much we document, but it doesn't
Mhm.
highlight actual, like, I feel like I'm documenting a lot, but it's like, yeah, if you document for an hour straight, you're going to be pretty tired at the end of the hour. That's only 1 hour. And you had
Right.
5 hours of ATF time that day. So that's not nearly 50%. Ashley, do you fall in that 10 to 50 or near that 33%?
No, I'm also way less.
Mm-hmm.
And
I would
even
say
more
I'm
so
too.
now because lately I've been trying to document while I'm going. And that has streamlined things for me. And I'm like, it's getting in there better than it was before. And yeah, I'm really enjoying that process. Um,
And even just
Um,
getting the gist of it down, you don't have to make it pretty. Like, don't write it out in the formal sentence. Just be like, flexion 5 out of 5. And then
I
when you
was
go
just
back,
gonna hit
manual
that
muscle
too,
testing,
CJ.
flexion with 5 out of 5 with no pain. You can clean it up later, but remind yourself. And then you don't have to sit there and remember. Yeah, Katie.
Here's a question you asked me earlier about documenting, well, multiple things you asked me earlier this week that were off air, but like when documenting at other games, I don't necessarily like, I don't like having my computer out at games, but I for sure have my phone, and I look like a crazy person talking to myself because I will use that spreadsheet to just like talk to text the note into my phone so that then I can copy and paste it later and then fix it. Like I don't use my talk to text for that. It is an option. Like we have an app on our phone that our documentation system runs through, and so you could talk to text it. But I at least like get my thoughts in there so that later when I do the documentation, it's way faster. So like if I have a game until 10:30 at night, football, at least the injuries that happened are in my phone, and the basis for what my note needs to be when I write it on Saturday afternoon um, is there.
The
So it
meat's there, you just make it prettier.
Yes, and so yeah, so you just edit it to make it look nicer, but you can save yourself time that way. So if you're doing it in the athletic training room and doing it while you go, like minimum, if you're not using the fancy app that Amy sent us, um, then you can like make yourself notes, and it just makes your life easier. There are easier ways to do it. We're trying to give you those easier ways so you don't have to learn them on your own because it takes 15 years to learn them. Um, but we're trying to make it easier.
Yeah, and I think I know, Katie, you are a big proponent of when you're covering a game, you're covering a game, and I think that perception is important, but also being in the right mindset to handle emergency is important, and that dictation can come in handy a ton because you can be on the sideline watching, paying attention, get a quick blurb in, and then you're like, all right, I got that information down, and then during the next timeout, get a quick blurb in, all right, I got the information down. Whereas if you're typing it and on a computer, perception is not great that you're not covering the game, but also it takes longer to do that. I feel like when you're dictating, you can get a lot more in between, and then you're just getting enough thoughts down that you can efficiently get it on paper later. Ash, did you have something to add to that?
No, not really. I do the same thing. And I like, for those of us not allowed to use Google Sheets or Google Docs or anything like that anymore, it has become a little more difficult. And it's probably not the best solution, but for that, especially like game side thing, I have to use like the notes app on my phone and I'll dictate to that
Mm-hmm.
because our EMR systems time out for security wise, right? They like, you
Mm-hmm.
can't just keep it open all day. So I've lost so many notes because the system has timed out. So I'll do my dictation on a notes app and then I'll quickly copy paste and then delete from the notes app. So I'm very good at making sure that gets deleted immediately. But yeah, that's what I do
Mm-hmm.
too.
I like that.
And even our docs on the sideline at football games, they're on the side dictating their notes from the day too. So
Yeah, and I think perception is real. Listen, I'm all about the perception of the athletic trainer on the sideline. But I will tell you, volleyball games, I will have a standing desk out and have my computer in front of me because volleyball, I feel like I can effectively have my social awareness and be able to get some documentation done at the same time. Other sports, I like, you'll never catch me with a computer at a soccer game or a football game or lacrosse, some of those sports where it's like, no, no. But at a track meet, yeah, I have my computer out and I'm just putting it in as they come because it's easier that way.
Mm-hmm.
But I think it's important for people to know that if they see you with a computer and they're like, what are you working on? And it's like, oh, nobody sees the documentation side of our job. And they need to know that you're doing it. And I think that's, again, proving your value. If someone walks up to you, if the CFO happens to have a kid that plays on your volleyball team, they're like, oh, what were you doing on your computer the whole time? And it's like, oh, I was trying to not take work home with me tonight. They get that a little bit more when they see it happening. So I don't, but like if I'm sitting outside at football practice, because it's practice, I can't follow all the groups anyway with my eyes. So I'll do some of my documentation when I'm at football practice because I don't like, I'll say this every day of my life, I don't like to sit in the athletic training facility when there's no one in the athletic training facility. I think I should be outside with my eyes on a field or making my presence known that I'm out and about and moving. And if someone needs to talk to me about something, now's your chance. Or I'm on the golf cart, but I will do my documentation from the golf cart.
Yeah, because it's not realistic for you to watch 10 different things going on, so you might as well.
Right.
Yeah.
But I think there's a difference between being on your phone, being on your computer, or reading a book, or being on your phone, being on your computer. Right. And listen, summers all the kids at the school I'm at now, I crochet, you guys, I'm a nerd. And they all laugh. But when I'm crocheting, I can watch the field. And so there are different activities, athletic trainers, that if you're doing those, you can do some of them at practices, and you can do others you can't do. So that's just my tips and tricks. Is having your computer out makes it look like you're working. Being on your phone, being on a book makes it not so much look like you're working.
Yeah. Yeah, which is crazy. But I think the next article that we had, it's from Kasamatsu et al. From 2020. I think it highlights the documentation hours a little bit better. They found that on average, participants spent approximately 5 hours per week on documentation, and that was often outside of regular work hours. That's probably more in line with, I don't think 33% is realistic. I mean, that's a lot of hours. We got to get better at what we're doing if that's the case. So I think that's a little bit more accurate. And I think, a lot of us do documentation outside of regular work hours, but what in the world is regular work hours for high school athletic training? Those don't exist. So yeah, I like the 5 hours. I don't like the regular work hours because we don't work in regular work hours, but
Well, and a lot of times those 5 hours, can you just go to your school early to get them done and clock
right.
in? Like,
And
why are
are
we
they
not?
counting that as outside
Right,
regular? Cause I went in
right.
earlier. So yeah, take that
Yeah.
with a grain of salt. Okay. So one thing that I think is awesome with athletic training is we each have our skills and skill sets that we can share with each other. And I think it makes us stronger as a profession because we can learn and collaborate, and each person has a different, like, really good skill set. When it comes to documentation, I think my opinion, I think it's the consistency hurts us, or the inconsistency rather, because we each have our own criteria for what to document. We have some standards set by our employers, but we each kind of have, like, here's what I do, here's what I do, here's what I do. Some people only document time loss injuries, which may leave patient encounters unrecorded. Ashley, do you think it's beneficial that we have flexibility in our documentation, or do you think overall it's a little bit more damaging due to the lack of consistency?
I think the flexibility in our field is really needed. Um, and because of our random weird schedules, that does make consistency sometimes difficult, but that's just kind of the nature of our beast.
Mm-hmm. Katie, how about you?
Yeah, I think I oversaw every different level of school. So 5A to 1A. And that flexibility matters a lot, because if you're at a 1A, 2A school and your total fall athletes is 40 versus you're at a 5A school and your total fall
At a
athletes is
zero.
6 or 700. Yeah, like it's great, like, to be like, you guys all have to document the same amount. Like, the value model at those two schools is going to be wholly different, right? And so I think the flexibility to document matters. I do think there should be guidelines, which we discussed the non-existence of in the first episode.
Yeah, it's the answer falls in between, as always.
Right.
But okay, so going back to that Kasamatsu et al. Article from 2020, we're going on professional development needs, because that, Katie, you're killing it with the segues today, by the way.
Yes, I'm so good at this. It's
t-
because
t-
I love documentation.
One of the
Sorry.
things that was cited in this article was that there was a significant demand for more specific professional guidelines, and practical resources like soap note templates and feedback on documentation practices, so that we kind of, yes, it's going to be different. The flexibility is needed, but can we have some guidelines to work within? And we talked about the guideline in last episode and how it doesn't really give any guidelines. And that was cited in a couple different articles. So AT's expressed a desire for training that highlights how quality documentation can improve clinical practice and provide legal protection. So there is a desire for more information on this, more guidance. It's been cited in research. So just throwing that out there. All right, we're going to finish out with some tips to increase accuracy and efficiency. We've already talked about this a decent amount, so we'll kind of stay a little bit more surface level on this to wrap it up. EMR templates we touched on. Healthy Roster has templates that when you enter it in, it formats it for you, but also when you hit enter, it enters like each text box. So you just go down by each text box, which is nice. You do have to write a reminder in to know what each text box is looking for, or if it's built into a sentence, how that sentence is grammatically done. But it has that template that you can use. You can always pre-chart, so you can always just hit enter, and then you don't have to fill in everything per box. You can just look at the note and fill it in as you go. Sportswear has auto type, which is pretty much a dot phrase. but it doesn't allow you to use dots. Interestingly enough, it has to be like like letters. Um, so that's nice to have everything kind of pre-put in there
You are
as another
speaking a
template.
foreign language right now.
Auto type is just what it's called. It's a template, but it's a dot phrase, like dot SOAP, and then it puts your template in there. Auto type, you just type SOAP and it puts your template in there. So it's like the same, but it's not. Sportswear isn't very good at like formatting it. Um, Open Evidence is an AI tool. It's HIPAA compliant. I think you might have to sign like a BAA or something. There's other ones that have that. I know Abridge has that, which is it's ties with Epic, but it also has its own standalone thing. So there are other ways that you can increase accuracy and efficiency of your note taking. Any others that you guys are aware of that you utilize in your everyday practice? No? Okay, cool. Another tip is to have an algorithm or a process that you use. So we've talked about this a lot, and Katie loves this. Scheduling with intake forms, where you have the SOAP note, like the subjective part already on the QR code, is awesome. Makes for hands-off collecting of several key pieces of information that can remind you of what you did and what you're seeing. You can also have outcome measures built into those. So you can either have them printed out and be like, all right, we're on this day. Here's your outcome measure. That can be either medical or community based. Those can help increase your value and mainly your worth, because outcome measures are what's cited a lot of the times for, like, when you look at research, it's like, oh, we need to start tracking outcome measures. That's where we actually define what we're doing is effective. We talked about documenting objective findings as you go. That's super important, so you don't have to remember, because having to go back in your memory bank slows you down a ton when you're documenting. So that's a really good tip. We've already talked about having processes in your clinic, having a schedule, having taping first, and then people come back. So you're not trying to tape and do rehab and then try to remember everything all at once. Separate it, spread out your athletes. Prioritize the athletes who have to go out to practice rather than athletes who aren't. I actually, funny story real quick. I had like 3 in season athletes, and they're like gearing up for playoffs. And this was like last week or something. And then I had a baseball kid who came in, and they're doing off season workouts, and he needed his shoulder looked at, and like this one athlete came in, I'm treating her, and then another athlete came in and needed to get taped. So I stopped and I'm like, okay, her. And he kept on getting bumped back for 2 or 3 athletes, and he was a freshman, but he got a little snippy. He's like, "Can I get next to me?" "Yeah, sorry, like, I gotta get the in-season athletes out first. They're practicing right now, so we gotta make sure they're out, and, like, I'll get to you as soon as I can." He goes, "Well, I'm in season." I'm like, "It's February. You're baseball." Like, "We're practicing." I'm like, "Yeah, but you're not in season." "I'm in season." I was like, "Oh my goodness."
Did you kick him
Um,
out? I'd have kicked him out.
no, I was very polite. I was very polite.
Oh, you're nicer than I
I
am,
was like, "So
CJ.
by CHASA, you're out of season, and here's why." I'm like, "Would you like if you were in season, I'm treating an off-season player?" And you're like, "Hey, I gotta get to practice. It's going on right now. We're about to go to playoffs." And I'm like, "Yeah, but I'm treating this soccer player first for boys. So you're just gonna have to wait." Like, wouldn't go well. So he understood in the end. But yeah, prioritizing and is important. Spread your athletes out. Educate staff on the effect of 1 AT for however many amounts of athletes. Advocate and brainstorm ideas for finding additional time or treatments during weight class, sports class. And we've talked about that a little bit, even during practice. If they're not practicing, have them go for the first half while you're getting other stuff done, and then come back. Um, Implement scheduling. We talked about that a little bit. I think that's the biggest thing that helped me is I don't need all my rehabs to come in at 5 o'clock when I've gotten all the taping done and everyone's, or 4:30 when I've gotten all the taping done. I don't need you all to come at once. If you're a 7 o'clock practice, come in at 6, do your rehab, and then go out to practice at 7. If you're a 4 o'clock practice, come in at 4:30, and then the other half of you, I'm going to have to come in at 5:30, and then you'll be done at 6:15 and can go home like normal time. So that's helped a ton. There's a free app or a website called picktime.com. Is that what it is, Amy? Okay. So you can utilize that. Healthy Roster has a scheduling system. I don't remember if Sportswear has one or ATS has one. I'm not sure, but look into your EMR, find out. That helps a ton, because then you're spreading out the athletes. And if you have 3 people doing rehab, you can much more easily document that. Document during half times and breaks. I know it's hard. Like, sometimes we want to just be like, oh, okay, taking a quick breather, but that's an easy time to just dictate real fast what you saw. And it takes like 5 seconds to dictate it. Boom, you got it in there. And then you can go back to what you're doing. Don't go into the locker room if it's, so I see this a lot actually, where we'll have like soccer teams. One will go into the locker room, the other will go into the visiting locker room, and the AT will go in with the home team. Yeah, go like see if they need anything. If they don't need anything, the other team might need something for halftime. They forgot to say something. They might come running out looking for you. And if you're gone, hidden, not super helpful. So that benefits that side, but also you can crank out a note real fast or dictate something real fast while you're out there, and then you can polish it after. It's easier than trying to remember everything later. Katie, do you have anything to add on that? Your eyes got a little wide.
No, I don't think so. I was just the going into the locker room and staying in there the whole time. You're treating everybody, not just your team. Remember that. I know we're all home team fans. I get it, but everybody needs your help.
Football's the only one where I'll go in because they have another athletic trainer.
Usually, yes.
Most of the time.
Yeah. Go check in with them. Check in with them first. Make it seem like you listen. I'm all about not seeming biased when it's happening. Go check them first, then go in your locker room. That's fine. Just let them know.
You usually know what you have waiting for you.
Yeah. Hey, do you guys need anything? I need to go into this locker room for XYZ. So if something comes up, know I'm in the locker room. I'll meet you back out on the field. Something like that. Yeah, don't just disappear with your team. Don't just disappear at all. Like, make sure people know where you went. Like, even if you're going to the bathroom, like, just like let the game manager know, hey, I'm running to the restroom really quick. Like, we're all human. It happens. Like, but just somebody know where you are.
I love when they ask, like, why are you telling me that you're going to the bathroom? It's like, because people are going to be looking for me and I need you.
And the one time I don't tell you, they will need me like immediately. Perfect. And then the last one that I have out here is carve out dedicated time for documentation. I think this one's super important. We feel like we work a lot already, and we do. We have long, weird hours, which make them feel even longer. A lot of people I know go into the ATF and document because they're like, if I'm at home, I'm going to get distracted. If I go to the school and go in my ATF, I can really focus, and it puts me back to where I was doing it so I can remember and kind of visualize it better. That's a great strategy. I did that all the time. I also closed my door and locked it. And then when kids were knocking on it during lunch, who I knew didn't need to be seen, I would pretend like I wasn't there, and I would stare at them through the window and be like, I'm not here. So it worked for me really well, but doesn't work for everyone. Ash.
I always put a sign on my door when I'm doing that says meeting in progress, do not disturb, or call if emergency.
I like that. Yeah. And honestly, if it's outside of your normal hours, they're not expecting you to be there. And if you have the scheduling, they're especially not expecting you to be there. So it makes it a little bit easier to navigate that.
For sure. But these kids have spidey senses. They can sense when you're in the building.
You almost have to like sneak it, put your hood up, like sneak in. Yeah, because they know when you're there. It's weird. They'll hit you like as soon as you open the door. Like, oh my gosh. If you're required to be at practices, try and document while at practices, like Katie said. Just get the gist of it down if that's all you can do, and then watch and so find some time to document. If you get interrupted in your ATF a lot because those kids are really good at spidey senses, or you just kind of have an open door policy, find somewhere else to document. Maybe go in an hour early, and if you can't do it at home, maybe go into your main office, into one of the meeting rooms, and crank out some notes before you go and open the ATF. Get creative, find somewhere, but find that time every day to document. Even if it's only 30 minutes, go in, document, get some stuff cranked out, and then do what you can in the ATF. And it helps alleviate that a lot. All right, let's see. Do you guys have any final thoughts on any of those?
Of course I do, CJ.
Okay, I didn't think so. Ashley, you got any thoughts? No, I'm just kidding. Katie, go ahead.
Here would be my suggestions, because we kind of briefly hit on all these excessive things that you need to document that are not daily documentation, but they do fall under the purview of what athletic training is and does. And so I would say, if you are like a 10-month employee or a 9-month employee who does not work year round at your school, this is where you argue to be a full-time employee, or you argue for more pay, or you argue to show your value or worth, because EAPs are part of your documentation. Field safety, weather, all of these things are things that come up as part of your documentation, and it is part of the safety and preventative measures that we all participate in. Making templates that will make your life easier later. All of these things fall into that. Those are really good summertime things to do. In the months of June and July, listen, I'm not arguing to keep Ashley in her school in June and July. She will fight me on this, and we'll have it out later. But I'm saying for those of you who are not and need to get this done, because yes, over the course of a long career, it makes it easier. If you're not there yet, you need the time to learn it and do it, and practice makes perfect. But you can every year, as you're supposed to, review your EAPs and make sure they're up to date and all of these things. On those, you can mark any field safety things that you found, because you could go out and walk a field in June with way more time than you could do it in September. You could go say, okay, these are things that I could foresee an issue with. If you are a full documentation nerd and have a logistics form for every practice field that maybe exists, and
Katie.
you list all of these things, like where the equipment for that sport should be held, where you can find the nearest AED, where you can find all these things, that's an easy spot to list. Like, hey, other athletic trainer who comes to my school to cover my football practice, and you don't know anything about my school, you now know where the golf cart is, where the equipment is, what the field hazards are. If it's raining, be aware of this. These are things that you can have documented ahead of time, and you never have to think about them again. The wrestling room gets cleaned every Wednesday, and this is how we know the mats are getting marked down, because Katie is obnoxious and pointed it out to our custodial staff. These are things that can go on your logistics form, and then it's documented. And if anyone ever brings it up, you can say, yeah, we update our EAP every year in March, and here's the last updated form of it, and it was documented that this was a problem. Not my issue anymore. I brought it to everybody's attention. So this is your argument for your value worth argument exists, and this is where it exists. Look at this 40-page document that I created for you over the summer, because you know that 40 pages doesn't happen in a day. And then your EAPs are all up to date. You spent your time doing that part of your job, because it is also documentation. So is your cleaning schedule. So is, like, I sanitize my water bottles every day. I had a dishwasher. They go in the dishwasher. The kids who help with that scan the QR code and mark that they're the ones who put them in the dishwasher that day. So if someone comes in and said, hand, foot, mouth is going around, did you clean the water bottles? Yep, we sure did. And here's how I know, because it was signed off on, because someone scanned the QR code that day. You can make your life easier, but do it ahead of time. And again, argue for your full-time value.
And if you're panicking because you're like, oh gosh, I haven't documented any of that stuff. If so, I've worked where I had like set hours and I was salary hourly, and it was like clinic hours plus games plus like Saturday games, right? So during the fall, obviously, I don't think this is surprising to anyone. Those hours would go over 40 hours pretty easily. And that was just, clinic hours. And then, if I had 3 volleyball games, a football game, and then a late soccer game that week, like I'm going from 2 to 10 every single day. And then I've got 4, 5, 6 hours on a Saturday. And then I got to find time to document. So if that's an issue at your practice, track how often you're documenting, how long it's taking. Because I think, some of the feedback that we've heard is, well, I'm expected to get my documentation time done in between, like while I'm in the ATF or like in between games. And that's just not, a lot of times it's not realistic. Sometimes, sure. If you have teams that are away and you have like a random 1 or 2 hours where you're like, wow, my ATF's dead. Sure, we can. But on that week, if you're pushing your 40 and you're like, man, I've been slammed every single day. I have games every single day. And we all know if we have lower level games and the varsity game, that if varsity volleyball is at 6:30, they're going to start at 8. And then we're going to have all those volleyball games before where kids are going to be needing us. So not only are we trying to get our kids ready, but we're getting the lower level kids ready. And then if there's one injury, you're out of the ATF for like 20, 30 minutes going back and forth, getting stuff done. So that documentation is very hard to do. So if that's an issue that you have, track how much documentation you're having to do outside of those hours and say, hey, look, like I tracked, I'm taking 5 hours extra each week. But on weeks like this, I'm going to need 5 hours of overtime, because just to cover everything is 40 hours this week, or maybe even 42 or 38 or whatever. And 2 hours, it's just not realistic to get it all done. So you have to have that data together. Katie.
And track the interruptions, because like you can't control inclement weather, you can't control emergencies occurring, and as soon as those happen, they derail everything. My argument against being a salaried athletic trainer has changed immensely over the course of the past year, but I'm sorry, if a game gets delayed and it's my call to make, and I delayed a game by 3 hours due to inclement weather, like, why am I not being paid more for those extra hours? Because it's not my fault, but I am the one in charge of making that decision. So I, I got to be paid for my, like, I just lost 3 hours of documentation time to watching a lightning storm blow over because I have no control over that. But I'm also, trying to help make decisions happen. Hopefully, if it's just a practice day, we're not just sitting in the school all that time, and maybe you can do your documentation then. But like, there are times where it's just not feasible and all you're actively doing is controlling the weather, which is what I choose to believe I'm doing when that's happening, just so we're clear. But
Well, we do control the weather
yes,
from what I've been
correct.
told. Yeah.
But documenting interruptions, like, hey, I had 15 notes that I was going to get done in this hour and a half, but someone came in at the end of practice and we ended up calling 911. And now that documentation time was totally taken over. By now, I have to document the emergency first because that's now the priority. And I also need a debrief meeting and I have to call my supervisor and the athletic director and fill out an incident report and right? We just added time to something that I didn't have time for in the first place.
I'm so glad you said that, because I'm going to interrupt you real fast.
No, do
I
it.
think that's such a good point. Well, I think when one of the great arguments against that whole, like, well, here's your set schedule, get your documentation done within that time, that doesn't account for if I've used my 40 hours this week and then I'm about to clock out on Saturday from the JV game and I have a kid come over and say, hey, I have a concussion. Great. That's an entire hour 15 when you take everything into account of the evaluation is going to take some time. And then I got to call the parents and I have to answer their questions. Then I have to document everything. That's over. I'm now over and I'm hourly. What am I supposed to do? If I'm right on like my 39 and a half, 40 hour clock, am I going to get approved or am I now working for free? How does that work? Because those need to be built in. Is that approved that I can stay and submit over time if I have something come in? My point is, nothing ever happens according to a schedule. We always stay later. If I have a game that's volleyball is supposed to start at 6:30, they start at 8, I'm there till 10, but then there's a concussion at the end and I'm there till 11. How is that built into my schedule? Do they account for that? Because then by the end of the week, I'm 3 hours over based on what my schedule is supposed to be, but our schedules don't typically follow what they're supposed to be. So
And
use
that should
that to
be
your
part of
advantage.
your CFO conversation as well. Hey, I know that you're arguing that I should only be working at my school for 40 hours a week, but let me tell you about all these things that come up that are outside of my control. Who do I call to get approved for the overtime? Because it's not you. It's never, like, at least if you're working directly for the school, it's for sure not the CFO, but half the time you're not even like, if the athletic director is who you report to and he's sitting there with you, he's like, yep, just go ahead and mark that as overtime. Maybe, I hope. But if you're an outside contractor, like, do I have to call my boss who then calls this boss to verify that that's what happened? Like, these are value model worth things that you need to discuss when you're negotiating salaries, when you're negotiating how you're being paid and your worth, because it happens. And now we're 12 overtime hours into fall season 1 week because football hasn't been able to practice all week. So they decided to practice from 6 to 8 p.m. instead of 4 to 6 p.m. because we live in Colorado and that's when the storms roll across. Right. And so that's the discussion to have. Like, I don't control the practice schedules. I tried to come in to account for that, but are you making me just cover football now because you just complained that I tend to bias football? I didn't bias football. Football decided to practice later, and now all the other teams don't have someone on site for their practice. Like, what is the argument? These are your arguments.
Yeah. Ashley, any final thoughts on all that?
No, I think Katie covered it all.
Please don't hate me.
Now, I would just say our documentation styles are going to keep changing and evolving. One is technology evolves. Hopefully, technology makes our lives even easier in this aspect. But it does take time to learn what's new and all the intricacies of your injury report system. So take the time, learn it, and come up with the templates and just make your life easy.
Yeah, it's a process. So thank you to everyone for sticking around with us through 2 episodes. Are you okay, Katie?
Well, I just thought of something and we should probably cover it on a different episode.
Okay, well, Thank you for keeping it in.
How you
No.
document?
No. We will talk about this on another episode. We are 2 episodes into this topic. So thank you everyone for hanging around with us and being patient as we split this into 2 episodes. This ended up being a beast of a topic that we did not expect. We actually expected this to go kind of quickly in 1 episode, but thank you so much for listening to this episode. We've been the CATA Secondary School Podcast. Thank you again to Amy, Katie, and Ashley for adding their perspectives and helping out with the podcast today. If you enjoyed the conversation, please don't forget to like, subscribe, and share the podcast with colleagues so that we can keep on improving. Feedback is super helpful for us, and we love helping athletic trainers in Colorado. So we love kind of helping out with that feedback. New episodes are released every other Friday, so be sure to check back for the next one. Thank you so much for listening, and until next time, take care.